Computer. Hi, Doc. I'll just introduce you in 2 minutes, then you can start. Dr. Sukrit Kumar is a friend of mine. We both are in ISLM group, Indian Society of Lifestyle Medicine, a pro-lifestyle medicine physician too. He has vast experience, around 20 years of experience in different areas of healthcare, ranging from the corporate sector to the government sector to the public health. And he also worked as a consultant for various organizations. He also has a that's a huge experience which spans across over a period of 20 years. But he also has huge experience with related to the current topic, actually. So that he will also be discussing right now. So I'm Dr. Regina Shahin. I'm the co-founder of Invest on Health. We used to have these webinars every month once to educate common public about various aspects of health. We stopped it for a few months. We just took a break. We'll be back with more and more webinars soon. I have IOH's clinical program coordinator Bhavani with me, and few friends and other people. And now people are joining. Let's see what Dr. Sukrit Kumar has to say and what we can learn from him, so that we implement these measures in our lifestyle, so that we don't have to look for authorities to do something. They definitely have to do, but we also can do a lot from our side to protect us from our families from these dangerous conditions. Because I myself had a bad experience with my daughter in 2015. I used to involve with a bit of activism at that time, because it was a terrible situation, actually, being in spite of staying in a very upmarket environment, child going to a very good school, rather an upmarket school, or with all facilities. My child got dengue, and it was a very bad situation. She started bleeding from nose. I lost around 4 kgs in 10 days, the kind of stress I went through. So I think it is something which a lot of people can relate. Let's do something about it. Let's listen to Dr. Sukrit Kumar. Thank you. Over to you, Dr. Sukrit.
Thank you, Dr. Regina, for such a wonderful introduction. And I couldn't agree more that it's both a micro and a micro level problem, where we have to, once we know that what is it we are into, we should be able to do something about it. And then to understand that, I'll briefly run you through the clinical dengue fever, and then we'll talk about the public health side of it, and then what we can do at a micro level. And also I'll share my own experience, Dr. Regina was mentioning. So first we will start with what is dengue, and it's a emerging tropical disease, if you see, and though it's been around from last 1945, it was first detected, but actually in India this has a very recent history of emerging as a endemic and epidemic disease. And it is a vector-borne disease. Aedes aegypti, it's a daytime mosquito, which it's a fearless biter. So once it sits, it will bite you. So one of the preventive measures is to prevent from mosquito bite. That's the only preventive thing that you can do about not contracting a dengue. So it is called tiger mosquito, and it has a very low flight, and it is usually breeds in stagnant water, cooler, the pot that you keep for birds, construction sites, lakes which are not moving. And trust me, if you have a bucket of water which you have left outside, and so the larva to pupa stage is 6 hours only. So in one day time, if you have left it for 2 days, there will be swarm of mosquitoes, Aedes especially. And so the idea is to clear all the stagnant water source, whether in your home, society, streets. That's the only measure that you can do as a community to keep it away. So it's a notifiable disease. So why notifiable? Because it's preventable. So if you know that there is one case in one area, and you know that that happened in that particular area, so you can do quick measures to, stop all the breeding grounds. Be very very cautious about using mosquito nets, repellents and sprays, and wearing clothes, full sleeve clothes, so that the bite does not happen. So when we see the classical, it's a 4 to 10 days of incubation period by the time mosquito bites and the symptoms occur. And it has wide clinical spectrum. So, and it has 3 stages. So febrile, critical, and recovery. So febrile stage is a little bit safe, but critical stage is after 2 days. I mean, after the febrile stage goes away, then 2-3 days are very critical. So it's a 2 to 7 days of febrile illness, headache, retroorbital pain, myalgia, arthralgia, which is like pain in muscles, maybe in joints, rash. There could be hemorrhage manifestation, petechiae, mucosal membrane bleed like nose and mouth or vagina, and then positive tourniquet test and leukopenia, followed by rise in hematocrit and fall in platelets. So this period you will uh, know that whether it's going towards a severe disease or a shock syndrome or hemorrhagic fever. uh, Once the fever goes, that's the most important phase, where that you get to know whether it's going towards, if you manage it quick, I mean, intently, because that's the phase that the major complication like cerebral bleed, GI bleed, vaginal bleed, massive bleed can happen and quickly go into shock syndrome, and then the revival is very very uh, you know tricky. So, and then there is a recovery phase which is followed by 2 to 3 days, and then you are, so the most important part here is to understand when the fever goes, that's the top point. For 2-3 days you are very vigilant, so anything, so all the organ failure also happen in this phase, because if I explain to you in layman's language, hematocrit is the volume of your cells in your blood. So if the hematocrit rises, then the blood becomes thick and it can choke the venules, arterioles, capillaries inside the organ, and then the organ fails. And then there is platelet count which is falling down. It can give rise to bleeding. So these are the two things that happen during these phases. And it has also I'll explain to you later why this happens, because there are 4 serotypes of dengue. So one serotype, if you get infected, that phase will go unnoticed, or it will be a normal febrile illness. But the second time, if you develop dengue, then there is an antibody which is present, which was formed during the first infection. So cross infection is most dangerous, because what happens then, there will be a immunologic response to this virus illness, and that you can go into hemorrhagic fever or dengue shock syndrome. So people living in endemic zone now, Bangalore also has become endemic because there has been previous episodes of, so it's like Delhi now. So Delhi was in 2006 and 11 and 13 and 15, and then every alternate or 2-3 years later, there is a spurt of cases. So lab diagnosis. So one is clinical diagnosis, what I explained to you. Then lab diagnosis is NS, and one antigen. You do it after 1 day of your fever, or IgM or PCR. So PCR is more specific for dengue. And then there are certain follow question like lab features, like there will be a progressive leukopenia followed by a rapid decrease in platelet count in parallel with the rising hematocrit compared to baseline. So hematocrit is more important than platelet count, but you have to look at both. And in severe cases, you have to look at LFT, KFT, electrolytes, blood glucose, cardiac enzymes, bicarbs and lactate because of acidosis, ACG, and urine-specific gravity because sometimes there is a kidney involvement. So, what are the warning signs if you know that somebody has dengue and then because it requires emergency treatment and then you can't keep the patient at home. You have to refer and get institutional care. So, abdominal pain and tenderness, persistent vomiting, clinical fluid accumulation in any of the like pleural space or abdominal space or cerebral space, mucosal bleed, nose, mouth, vagina, or anal or rectal. So lethargy, restlessness, liver enlargement if more than 2 centimeters, and then increase in hematocrit and rapid decrease in platelets. So it's the rate at which this becomes a warning sign. If there's a rapid fall in platelet count and increase in hematocrit, then that's the time that you refer and get the things corrected. Because hematocrit you can always correct by fluid therapy, which is like out of scope of this discussion, but still I'm just so. How do we manage? So it's a non-pharmacological rest, plenty of fluids, fruit juices, no carbonated drinks because then they increase the viscosity and then the hematocrit goes above. Then tepid sponging for fever. You try to keep it less than 99 or 38.5 degrees. Paracetamol 500 milligrams 6 hourly, not more than 4 times a day. There is no role of antibiotic. Aspirin and ibuprofen are strict no-no because they increase the bleeding tendency. So I was talking about my um, stint with dengue. So I was a resident at AIMS in 2006 when the first episode in Delhi broke down, and then everyone was affected. So there was a fourth-year student who complained of after like febrile illness. He complained of headache, and so now we know that if after febrile illness in a dengue endemic zone happens, then you should really rule out hematocrit. What is the hematocrit? What is the platelet count? And don't give ibuprofen or NSAIDs because they, by inhibiting the COX pathway, they will increase the bleeding tendency. So this poor chap, fourth year medical student at the Premier Institute in AIMS, went to casualty, was given Combiflam for his headache because there was no fever. He was sent back, developed a massive cerebral bleed during the night, and he was then resuscitated in the casualty early in the day, but 24 hours after he died. So very sad because we did not know the life cycle, we did not know the pathogenesis, we did not know dengue well then. I also got dengue at the same time. Everyone of, 50% of hostel was affected. So because we used to go out and eat in a particular, there was some construction going on. So, and during the daytime, you eat outside in the mess and then you get bitten by this target mosquito. So, but luckily, I also lost like 7 kgs during those 2 weeks of illness, and my platelet count started dropping after 80,000, and then my hematocrit also was not bad, and then but yeah, there post-febrile weakness was there for like 6 weeks. I used to have pains and aches all over. I went home from so uh, so that's the correlation that you do when so during this febrile period, during dengue season, usually rainy season is the season, and you know that dengue cases are happening, so to give nothing except paracetamol because that will sometimes jeopardize the condition. And if there is a dehydration, use ORS and keep record of oral take and urine output. That's the management part. So it's a vector-borne disease, and some of the other vector-borne diseases are malaria, filaria, Kala-Azar, Japanese encephalitis, and also chikungunya apart from dengue. So dengue is a Spanish term. It is called cramps caused by an evil spirit. So it comes with lot of pain and cramps. So so 1827 to 28, it was like a great Caribbean outbreak. So in India, the first strain was isolated from Vellore in 45, then Kolkata 63, then 1996, and then 2006, which was like the very so and this was seen by me. Then it happened every 2-3 years. This happened. So there are four classical dengue clinical syndrome. One is an undifferentiated fever, then classic dengue fever, and then dengue hemorrhagic fever, and then dengue shock syndrome. So how do we say that this is a suspect? So suspect is a case compatible with the clinical description, probable with clinical with one of the supportive serology, either IgG or in titer or positive IgM, and confirmed by lab diagnosis. Yeah. So then isolation of the dengue virus from serum plasma and autopsy samples or IgM, or there are PCR techniques which are more accurate. And now because of COVID, the PCR has become a very widely used modality. So earlier PCR tests were very expensive, 4,000, 3,000, but now you can get it done in 300-400, which is like gold standard. So it's the most common, like I told you, is undifferentiated fever, and um, which is the most common and goes unnoticed some of the time. And then the classic dengue fever, sudden onset, severe headache, and retroorbital pain. So myalgia and arthalgia, nausea, vomiting. Rash can be different at different stages of the illness. It may be maculopapular, petechial, or erythematous. And then there is hemorrhagic manifestation. Then unusual presentation is, a severe dengue fever has been with dengue hemorrhagic fever. So they can come with hepatitis and cardiomyopathy and severe GI bleed. And there are four necessary criteria for DHF: fever, hemorrhagic manifestation, platelet count less than a lakh, and then leaky papillaries like elevated hematocrit, low albumin, pleural or any other effusion. And then hemorrhagic manifestations are skin hemorrhage, petechia, purpura, ecchymosis, gingival bleed, nasal, GI bleed, hematuria, and increased menstrual flow. And then, like I said that four criteria of DHF. So it has four grades also, and we talked about the signs of dengue hemorrhagic fever, which is abdominal pain, persistent vomiting, abrupt change from fever to hypothermia. Like I said, that in critical phase this happens, and then restlessness or somnolence can happen. So these are something which I have already explained. So what are the causes of death? Is prolonged shock, fluid overload, massive bleed, or unusual manifestation like encephalopathy, encephalitis, ARF. So risk factor of developing hemorrhagic fever is viral strain. So pre-existing an anti-dengue antibody because of previous infection, like explained, or maternal antibodies in the infant. Host immunity also plays a part. If you have like good power, then the reaction also will happen more. And the age, of course, extremes of age has a connotation. So I talked about diagnosis, treatment, and how to follow up. And and these are the differential diagnosis of dengue, chikungunya, influenza, measles, especially in children, measles, rubella, and others like typhoid, leptospirosis, meningococcus, rickettsia, bacterial sepsis, or other viral hemorrhagic fevers. So there is a tourniquet test which comes positive in the early. So if you inflate the blood pressure cuff to a point midway between systolic and diastolic. So if somebody has a 120 by 80, you keep the cuff at 100 for 5 minutes. And if there are 20 or more petechia of per square inch, then this is positive, and this patient has a chance to develop a hemorrhagic or a shock syndrome. So you monitor quickly. So this is one of the diagnostic criteria also when you are diagnosing. This is how it looks. So lab tests we talked about, and then there are virus dengue specific tests like isolation and serology, and which IgM, IgG, CFT, neutralization, and NS1 antigen detection. And IgM is also a good criteria, and IgG is again titer is more important than just presence of it because it can show the previous infection. And these are the immune response. If you get in relation to the fever and onset of symptoms. And then there is academic discussion like dengue virus cultivation, how do we do it in mosquito, and how does it. And RT-PCR is a good method now to detect. So, and there are 4 strains, and some vaccine also got developed but never came into actual practice. So like I said, that in the primary care setup, it's the treatment is fairly simple. And if you have like a dengue classical fever or undifferentiated fever, there is no tachycardia, no hypotension, or no narrowing of blood pulse pressure or bleeding, or platelet count more than lakh, then and baseline hematocrit is not fluctuating, then you can treat the patient at home. Outpatient, like I told you, these are the warning signs, and then you have to hospitalize. So there are indication of red cell and platelet transfusion, which is out of scope of this discussion, but still. So there, what are there? Some misconceptions are that so somebody will say, oh, with dengue plus bleeding is DHF. No. So we talked about the 4 criteria. So dengue kills only by hemorrhage, no shock, and also poorly managed with organ failure because of rising hematocrit can succumb. So it's not only a pediatric disease; it's all groups are affected, and it's a misconception that it happens in low income group. No, anywhere where there's a water logging, whether it's the upscale market, upscale condominium, or a upscale school, this will happen, and this will happen fast. So tourists will certainly get DHF. No, tourists will coming from non-endemic zone because they are bitten for first time. They will not develop DHF because of course I told you how. So what are the options? So mosquito control, antivirals, vaccines. So mosquito control is the most effective. Either you control the mosquito or you get yourself, prohibited by a mosquito bite. These are the 2 micro things that needs to be done in your locality and in your area. And so Aedes is high dose domesticated, breeds in essentially stored clean water, and eggs can withstand desiccation up to 2 years. Okay, so rest inside, outside breeding containers or dark, humid places. Then flight range is limited, 20 to 30 meters. So it distributes in clusters. So strong preference for human blood and day biter, like I told you, it's a tiger mosquito. So once it sits, it bites even if you kill it. So key containers include overhead tanks, underground storage tanks, cement tanks, metal drums or the jars, rainwater harvesting tanks, and anything which you keep outside and you don't change the water. Unused household materials stocked in open trash and holding rainwater. Essential firefighting waters like construction of water tanks, one at the top and other at the ground level. So in buildings and sites, these are the place where it, in open heavy machinery, scrap material, where the rainwater came and it, so I heard there's a lot of rain in past few weeks in Bangalore. That's one of the reasons that every nook and corner you can find this rainwater, which is a clean water, gets stored, and then uh, so uh, so vaccines, though they develop, but not for use. And then vector control is how you do it. What are the options? So adult vector control is indoor residual spray, thermal fogging, and but fogging does not kill larva and pupa. Okay, so then there is government programs and their community-based integrated approach, which we are talking about, where you, as a society, as a condominium, as a group of people, you can do health education. You can also watch not to leave any open source of uh, breeding of mosquitoes. Do the fogging inside your society. That's something that and it has to be carried out in a weekly basis. So what we can do at the individual and family level, that you do a weekly test and weekly observation, draining all the containers and holding waters, flower vase, bird draining water containers, fresh trays, ornamental tanks, choked sunshade, roof gutters, rain who tap rainwaters, evaporation of desert coolers, and there are three stages: empty, scrub, and dry. You know, so scrubbing is essential for dislodge eggs sticking to water tray. Yeah, because eggs can survive for 2 years. And then screening of houses. This is also individual approach that societies took takes in Delhi during the rainy season. You check both the doors and window, use mat and aerosols and all out and the sprays which is available, and then securing water fitting manhole and screening of overflow pipe. And then peri-domestic, you remove all trash, small bottles, paper cups, tires, coconut shells, which holds rainwater. Metal drums and heavy materials should be kept upside down, not the other way around. Then there is partnership and intersectoral coordination, two societies coming together, improvement of water supply to minimize water storage. And at the community level, you can do health impact assessment, and you can do behavior change communication, including IEC, inform, educate, and let them comprehend. And of course, the professional management of solid waste disposal by the government or NGOs and welfare organization. So community approaches are difficult to define community geographically, and advantages that you have built in manpower, help develop resources, and but they are difficult to organize and longer. But this is a graded approach. When this starts, you do a family and then community, and so knowledge is not sufficient to produce behavior change, because behavior change is a intervention, and so need to address the skill deficit. That what are the so what are the cues that you can take as a public health measure? So use regular feedback, that what is happening, and every time someone receives the information, they can dissipate. And if the data indicate control activity is successful, then it serves as a positive reinforcement. And so what are the cues of presence of adult mosquitoes? So they are tiger mosquito, you can identify it, and so when person sees a mosquito, they can ask where did it come from, and then search for our habitat and destroys it. That's the best way forward. And then first, educate the public on basics of dengue, that is where the mosquito lay her egg, the link between larva and adult mosquito, general information about dengue transmission symptoms and treatment, what we are doing right now. And how to strengthen participation is ownership on the communities, behavior change, role of social scientists, and aware and knowledge will not only do, but only behavior change is something that will do. So that was my presentation, and now the floor is open for any uh,
Yeah, questions.
question.
Thank you, Doc. That's an elaborate, complete information about dengue fever. That was a lot of information. We got it. Few things I just wanted to, because there are non-medical people also in
Yeah,
the group,
yeah,
just wanted to, clarify or make it a little more in a common man's language. One is this febrile illness, and other things will be a little tough for people to understand what. So, few sentences, if you can tell us the differentiation. I mean, it is very difficult to differentiate dengue from other fevers in the beginning, but at
right, right.
least, a child gets fever, and,
Mm.
in a common man's term, what are the things we should be taking care of if it's a high grade fever and the child is very sick, retroorbital pain under the eye, or just above the temporal, that this area, child is getting pain, and not into the next phase, the phase one. And what are the measures a parent can take to control the fever, and also what are the things which they can observe before taking a decision to take him or her to the hospital? Because normally, with the current scenario, most of the people with the fever, they try to manage at home. If we
Yeah.
can tell these things in a common man's language, like, NSAIDs, if you can tell a few names like Overan, few things, I think that part would be very useful for people actually.
Okay, so see, for pediatric age group especially, the threshold for taking an online consult with a pediatrician should be very low. So once the child gets fever, do not wait. Do not only do give, because people start giving Meftal-P because of the later strains of COVID and hand foot mouth disease, and there are some Coxsackie virus which get, so you get a fever like 100, 304, and the pediatrician advises Meftal-P. But in it's little different because you know that this is a dengue season and the child could have dengue. So the idea is to take a online consultation with the pediatrician first, to because this disease rapidly become very serious and leads to emergency. So carefully watch the only fever or a positive tourniquet test or retroviral pain is not severe dengue. So you watch out for the sign of like a child become lethargy, refuses food, abdominal pain, become like there is some mental confusion, or you can see the telltale signs of dehydration or not passing urine. These are the some and constantly cries of like myalgia is fine, but the moment it says that severe headache, then you should be worried. So then you report immediately. And because the third to fifth day of illness is most critical when the fever getting down,
I
or
know.
even if, yeah. So then watch the patient or the child for like 2 days after the fever disappears. Arthralgia may continue for weeks, doesn't matter, and give large amount of water, because by oral fluid, if the patient is passing urine and stool, there will not be a fluid overload by oral intake. But what will it do? It will keep the hematocrit in a baseline level. And hematocrit is something that you want to keep at a baseline level, because more, because I have seen people having 20,000 platelets count and not developing
Many
any
symptoms.
complication, and they don't need any hospitalization. But somebody who has a fluctuating hematocrit which is rising high, then that's a patient that you should go for. So uh, after 3 4 days, I think a watchful thing is very important, and then you don't wait, because it doesn't give you time. Because what happens, is like we say that a penny of prevention is better than a rupee or a pound of cure. So the community focus should be more on prevention of mosquito breeding, mosquito bite. If you can prevent, that's the only thing that will go a long way, because once it happens, you have to be very watchful. And if you see any signs of complication, you please report to the pediatrician or your general practitioner, so that they know better. And if you see that there is lethargy, child is refusing to feed, vomiting is happening, there's no point waiting and wait and watch. So wait and watch will
Right.
not, yeah. So
Thanks.
if there is a dengue endemic zone, then I think the watchfulness is something that which is very important. And more than that, the mosquito control and the prevention of
I can
mosquito bite
already
is something.
hear some mosquito repellent thing moving back behind me because recently we lost a maid, one of our neighbor's maid who was working with us for almost 10 years. Actually, she was 40 years, dengue hemorrhagic shock, and she went into a coma. And they put her on a ventilator, and she was declared dead after 48 hours or so. That's very sad. And I told you that
Mhm.
there is a child, 7 years old, second grade child lost from Arena school, my daughter's school. So these are all very panicky situations, actually. So
Yeah.
as doc says, we don't know who's really going to get into this hemorrhagic illness and this shock syndrome
Mhm.
and all. It's better we start the measures of control.
Yeah.
First and foremost, what he said is, when there is a febrile illness, there is a fever-like illness. Actually, if it is very high-grade fever, normally dengue comes with a high-grade fever. Do not give any other medicine other than paracetamol or the Dolo one, actually, because
Yeah.
some of these NSAIDs, we call it, like Voveran, Meftal, those
Mhm.
kind of things have effect on platelet, which can also aggravate the complications of dengue. So try and limit those things as much as possible. And the child develops very severe manifestation, severe things of high grade fever, headache, stomach pain, abdominal pain, and stomach pain, and lethargy. The child is not able to get up. I know Arena was not able to get up, and I like so worried. And she even got into this hypothermia, where the extremities were become very cold. Actually, those kind
Yeah.
of manifestations, when you notice, immediately take the child to the hospital, because that level requires hospitalization and hospital management. And urine output, you keep on checking the urine output,
Yes.
the child
Yes.
is able to pass urine. Another thing, what because its major thing is public health and other things, I really want to talk a little, one or two more sentences about it. So what he says is, one of the calls, he was mentioning that parents send the children outside by putting those Odomos and other stuff, and they do not ask them to wear full sleeve dress or full length pants. I have seen a lot of children, they will be like roaming around here with very short shorts, and sitting inside these small straps and playing. Actually, I get very panicked when I see it, actually, because the consistent bite, if they keep getting consistent bite from mosquito, the viral load also will go high. Naturally, the
Yes.
complications also can go high. So can you just talk a little bit on that part, Odomos kind of things, how much protection it can give, or what is the best way? Is it better to send the children with full sleeve and fully covered this thing during the rainy season?
Yeah. So there is no substitute for full sleeves. How, if the children is going out, they should be fully covered. Okay. One. Then all the like neck area and the hair and hand and feet, and they should be wearing not slippers, but they should be wearing shoes. Only the hand and the neck area should be sprayed with Odomos spray. And there are some roll-ons also which are very effective. There are some straps which are available in Hemleys and all good stores, where you can, that they have a lavender or some oil which will repel the Aedes aegypti. And it's a daytime biter, so it's not that you switch off your all out or good night, which is your liquidator, during the morning, because what it's a typical Indian mentality that only sleeping time mosquito can bite me, which was true in times of malaria, which was female Anopheles bites during the night, but this time this mosquito is a daytime biter. So what we cannot reduce at the community level is the construction going on, and then the rain is happening. But what we can really reduce is inside our society, in the RWAs and the resident welfare organization. They can make sure, and they put the security guards in that there should be no water logging anywhere in the vicinity. There are people who put feeding water for dogs and birds and whatnot, but that's equally sort of, there is a tire which is like lying down, and they have a rainwater. That's a breeding ground. So these things should be actually addressed at the community level. But of course, in all during the home time, you're inside, you should have the liquidator on, or community level should have a fogging machinery available every Sunday or Saturday. You should do the fogging when the dengue season is there, which is all we do in our societies. That is why the cases are very less in last 3-4 years. And you go out, children are going to school, spray them with these sprays and send them in full clothes, either for school or for playing outside. One of the most important thing also from a treatment point of view is fluid therapy when somebody has fever. So you give large amount of fluids like water, coconut water, soup, milk, juices, not the carbonated drinks, but along with normal diet, because adequate fluid therapy will reduce the number of hospitalization, because then your hematocrit is, and give small amount of oral fluid frequently, so that there is no nausea or anorexia post that. Because so, but the mosquito control is the first and the foremost thing that should be done at the family level, also at the community level.
Okay.
Yeah.
Thank you so much. I don't think there are a lot of questions because you have covered a lot of, the slides covered a lot of informations actually. Thank you so much, Doc, for giving this information to us. And I'm sure that we will start implementing these things soon. My daughter already told me that after she lost a schoolmate that she wants to do something about it. So I told that when the vacation starts, you can start with your friends. My friends' children are also there. So Rupa's children, they're actually very active socially. They go to the orphanages and do a lot of things. So I told them, why don't you just check in our community itself? So after thing, we'll ensure that they'll wear complete sleeves and start doing these activities. And thank you so much for being with us for this 1 hour. Very informative, Doc.
Thank you. Pleasure is all mine.
Yeah. Thank you for all the people who joined us. Thank you, Bhavani, for sending the things in different groups, because it is Saturday evening. We cannot expect many people to join us, because a lot of them have said that we are stepping out. It's a very normal thing. My family is waiting for me to get out of this so that they can go out. It's a very normal thing in Bangalore. Bangalore is like Saturday, nobody is at home. Thank you, Doc.
That's okay.
Thank you.
Welcome. Bye.
Thank you, Doctor, for taking out the time from your busy schedule.
Thank you, Bhavani. Thank you, everyone.